Hello everybody, this is Dr. Fanny Yakaman, and today we're gonna get a fabulous topic which is called fractured teeth. Fractured teeth. They said, oh my God, I fractured my tooth, Dr. Yakaman. What should I do? I was eating and a piece came out. What do I need to do? Like in this case, using the American Association of Endodontics videos that we use for our patients to educate it. I am a passionate of education as a teacher. And when you fracture or crack a teeth at any age, the American Association here have pain in this patient that he fractured his tooth. You're gonna have pain on biting, you're gonna have pain on sensitivity, but not always. What happens when you have only a fissure that is only in this side of your tooth and it's aligned? Or it's better yet, listen to this. This is fascinating. This is a tooth with the crown. This is the crown, this is the root, and the fracture is only in this area, but it's not fractured here. And they want to take the tooth out. No, you tell them, I'm going to call Dr. Yakaman. A real fracture that you extracted to this when these two pieces are divided, or they cannot restore your tooth anymore. But if you have a small crack, you're gonna have a crown like we have in this case, and they're gonna prepare your tooth. How do we know that this is gonna be the treatment and no extraction? Well, if you don't have any pain, then we don't need to do a crown, or maybe they will just place a little composite around the tooth, the area that is fractured, if it's possible. But what happens when we fracture a tooth? Look at the screen right now. This is the enamel. The enamel is gonna break. The dentin is gonna be agitated. This is a vital nerve. This is vitality. It has a vessel, it has an artery, it has a nerve, and our whole mouth is functioning and chewing and moving around and doing forces of mastication. But in reality, inside, when I study molecular biology, you find out what is happening inside with the cells. All the cells are on top of everyone doing reactions that are gonna give you pain. Probably it doesn't, but it's gonna give you pain. So I give you very easy steps for your cracks. How do you know that it's a crack or a fissure or it's a fracture, total fracture of the tooth? Here we have number one, a coronal fracture of your crown. It's only in the area of the coronal part. But if your crown was fractured in a diagonal way, and this fracture can be restored by a good dentist with a replacement of the crown, you are safe. There's no pain, then you don't need a root canal, it's easier, it's less money, and they're just gonna place a crown because that's what we do in posterior teeth, not in anterior. In anterior, maybe, like we'll see in the screen right here, the anterior teeth are broken. So in these teeth that are broken, right now, what is gonna happen? Well, your dentist, restorative dentist, is gonna put composite, or it's gonna restore the tooth, or it's gonna have a crown. Both right there, that's it. When you have to worry is when the tooth is totally fractured. If the crown goes only here, remember, number one, that's the point number one, you don't need extraction. Number two, it goes down all the root. That's my second tip I'm giving you, is extraction. The root canal is done, maybe because you have so much pain. What are we gonna do? Well, maybe the crack is here. You know what is the result when we have this type of fracture here or crack? We can cut this root with a surgery and maybe the symptoms are be gone. But nowadays, many people doesn't want to do that because they said maybe an implant is more predictable, and the truth is we never know. It depends if you're grinding, what type of patient you are, and how much you're gonna take care of your teeth. So that is a decision that you and your dentist and your endodontist are gonna do together with your restorative dentist or a prosthodontist, whoever is restoring your mouth. So in this type of cracks, when you're gonna need to take it out, that you will need surgery, it's another topic that we can talk because it's an option that you can have. So people want to know what are the options I have. But if you have a crack that is inside your crown, like we see in this image, doesn't go down, doesn't bother you, they can save it, keep it. If you cannot save it after the root canal, take the tooth out. If the fracture was only corona, look at the screen right now. You can just put a restoration. It's a composite restoration and it's not a just. Dr. Richard will kill me because it's not a just. It's a complete composite restoration, or a filling that the patient calls is white. They can make the type or color of your tooth, and it's fascinated and you don't have to take out. But if it has pain, they're gonna do your root canal. After the root canal, you're gonna go to your dentist, they're gonna put a crown. So that's the point number 2, or the tooth is gonna be extracted. Now, if your endodontist find out that the fracture was so big, he's gonna take the tooth out. But if the crack is oblique, then he's gonna tell you to take care, to don't extract the tooth, and then to have an implant if the pain continues and the fracture was bigger, then you're gonna have to deal with an implant. And the implant is a topic that we're gonna call later. Nothing is better than your teeth. Remember that. Try to keep your tooth. Ask your dentist if you need a night guard to protect your teeth. Brush, floss, watch our episodes. We have an amazing amount of treatments, cases with our patients that you are gonna learn how to take care of your tooth. Having a healthy mouth with a healthy nerve is gonna give you a healthy digestion. You're gonna be able to eat very well and have the forces of mastication work very well in your teeth, avoiding all these problems. Thank you, and if you have any questions, contact Dr. Fanny Yakaman on YouTube channel or Instagram or in TikTok. Thank you and have a good day. Bye-bye.